Hello, and welcome to the first in a series of panel presentations on COVID-19 vaccines. I'm Jean Kelleher, Director of the Alexandria Office of Human Rights. We are collaborating today on this panel presentation so that we can reach all members of our community to provide accurate and current information and to answer your questions. We have grouped the questions into broad categories, and we are recording this presentation today so that we can share it multiple times in multiple languages. Today's panelists are Dr. Stephen Herring, Health Director of the Alexandria Health Department, Dr. Kim Luke, Medical Director of the Alexandria Health Department, Matt Harris, Chair of the Alexandria Human Rights Commission, Chris Harris, who is also a Human Rights Commissioner, but in his role as President of the Alexandria chapter of the NAACP, and Evelyn Urrutia, Executive Director of Tenants and Workers United. Acknowledging the terrible impact of the pandemic on our communities, I would like to ask Evelyn and Chris to begin today and talk about what they are seeing and hearing in the community. Evelyn?
Good morning, everyone. Thank you for that opportunity. This is a great opportunity to talk about our communities' needs, especially here in Alexandria. As we all know, the pandemic has really hit hard on especially people of color, working class, the essential workers, and it is important for us to really address those issues. Our community has gone through so much in the last almost a year now, since March. We have been really get hit by COVID-19. And now that we have the vaccine, it's an opportunity for us to really educate the community on how they can have access to it and when they will be able to have access to it. So we hope that through this panel today, we can definitely get some answer to those questions. The Latinx community, for example, in Alexandria have been really affected through this economically. And also with the lack of access to health is a big issue. The lack of trust that most of our community have with the whole system and the process is really going to be an issue. So we know that we have to do a lot of education and a lot of work to reach out to community like the Latinx, the Black community, and people of color in general in the city of Alexandria.
Thank you. Just to piggyback off of that, again, I definitely appreciate the invite and the opportunity to speak and to be a part of this. And just to piggyback off what Evelyn said, I mean, this is a serious issue, and it has been for over a year. And although there is a vaccine, we know that we're not out of the woods. We understand that this is a long stretch that we're going to have to deal with, and the challenges that we have in, namely the African-American community are broad. The skepticism is number one. The fact that there is not a whole lot of trust in the health department, in the system, in the city, and state and nationwide. The access, not knowing how to get the vaccine, not knowing what the criteria is. Being fearful of what happens when you get the vaccine, the data collection. I've talked to a number of people, and some of the things that I'm hearing are brand new to me that I didn't think about myself. Speaking to some in the community, they're worried about their immigration statuses by taking the vaccine. Where's the information going to go? We know that over the last few years, we've experienced a shift in racial dynamics around the country, and there is a legitimate issue that a lot of the community are concerned about. What I'm hearing also, namely, is they don't trust the messengers. Where is this information coming from? It's nice. It's good to have the information relayed by individuals that look like those in the community, but that always is not always the case. And I'm glad that I'm able to at least be a face initially, a trusted face, hopefully, so I can relay some of this information and display the seriousness of what we're going through here. And it is serious. We know that African Americans and Black and Brown communities have been hit disproportionately by this virus, and it continues to be so every day. Every day we look at the numbers, thousands and thousands of people are dying. And hopefully this panel and this informational will kind of open up some doors and make everyone feel a whole lot more comfortable as we move forward to the vaccine. Thank you.
Excuse me, with the mute button. You have both touched on very important elements of our conversation today in talking about the impacts on the Latinx community, the Black and African American community, and focusing on the fact that many in these communities are essential workers, and focusing on those who are living in close quarters, for instance, and those who own small businesses. The idea of trusted messengers, I think, is really important, and certainly both of you are trusted messengers in our community. And we do know, those of us who work for the City of Alexandria, we know about the distrust of government. Although we enjoy a good relationship in the City of Alexandria, certainly among our government agencies, with our nonprofits and our community activists, that's not always the case. And I think it's really important for us to focus on that. You've talked about the skepticism with the vaccine. The roots of that skepticism run deep in our history. And I think I would like to turn this over to Matt Harris to really give that human rights perspective and to pose some of the questions to our medical experts.
Thank you, Jean. It's wonderful to be with you all today. I want to say it's okay to be skeptical. There are historical reasons to be skeptical. Everybody should be somewhat skeptical. This is a brand new virus, a new vaccine, something that our society hasn't faced since the 50s with polio. It's untested, of course, but I think you should all keep an open mind. This is important. Listen to the scientists, the doctors, those who know what's going on much better than I'll ever know. You need to look at the data. You need to look at leaders who are stepping up and taking the shots. I trust Dr. Fauci, and when I saw he was eager to be among the first people to get the shot, I couldn't wait to get the shot myself. I don't think he would ever do something that would not be safe for us. And again, it's important that we all get to return to what was normal, our normal lives, as quickly as possible. There are many aspects of just living a human life that has been missing for the past year. But I also want to say we're very fortunate to live in Alexandria, where we have public health officials who are here and ready to take our questions and hopefully satisfactorily answer them. And we've sought questions from you out in the community. And these questions generally tend to be in 4 basic areas, and I'll get into the specifics, but the 4 areas are: is the vaccine safe? Is the vaccine effective? When should I get the vaccine if I've already gotten COVID specifically? And how is the vaccine distributed and scheduled? And when is it going to be my turn to get the vaccine? There's some more specific questions that I want to drill down and ask our fortunate public health doctors here today with us. And those questions, again, have come from the public in their broader and general. But if I've already gotten the COVID vaccine, should I get vaccinated? If I have a history of allergic reactions or complications or complicated medical history, should I get vaccinated? How long does it take for the vaccine to start offering protection? And are there any severe reactions to the vaccines in Alexandria specifically? And do I need to get a COVID test before I actually go and get my vaccination? So these are questions that I'll pose to our two doctors, Dr. Luke and Dr. Herring, and I look forward to hearing your answers. Thank you.
Sure, thank you. Dr. Stephen Herring, Director of Alexandria Health Department. I appreciate the opportunity to be here to talk with you all and talk to the community at large. I actually appreciate the word skepticism or skeptic. It's my understanding that that comes from the Greek to inquire, to actually examine, to shine light upon. So we want to inquire. We want to really examine things very, very closely. With regards to whether or not it is safe, I'm going to turn that over to Dr. Luke, as she has done a lot of research about the safety of the Moderna vaccine that we're offering, as well as the Pfizer vaccine. Dr. Luke?
Hi, everyone. So thank you for the question. It's certainly an important one to ask and one that we care very much about. The COVID-19 vaccine is a safe and effective tool to combat the pandemic. And the reason I can say this is because starting from the clinical trials, we've had tens of thousands of volunteers who received the vaccine with no serious safety concerns noted for the months following the vaccines. And at this point, close to 20 million people in the US have received the vaccine since late December. It's also been shown to be very effective. You might have heard 94, 95% effective, and I really want to drill down to what this means with an example from the Moderna trial. We've had 30,000 people participate in the Moderna trial. How this works is about half of them receive the vaccine and half of them receive a placebo. And among those that received the vaccine, only 5 became ill with COVID-19, and 0 were hospitalized with severe symptoms from COVID-19. On the other hand, among half of those who received the placebo, which means they did not receive the vaccine, 90 people developed COVID-19 and 11 were hospitalized with COVID-19. And so what this means is that you are substantially less likely to get COVID-19 and to spread COVID-19, and if you get vaccinated. And if you do happen to get ill with COVID-19, since nothing is 100%, you are keeping yourself from getting seriously ill from COVID-19 if you get vaccinated. And we know from the clinical trials that this applies to a broad diversity of people. 37% of participants were people of color, and that's a lot more than we've seen in clinical trials in the past. Also, a quarter of the people in the clinical trials were over 65.
And Mr. Harris, if I can answer the question about whether or not you should get the COVID vaccine if you've been diagnosed with COVID previously. The recommendation is that you do get the vaccine if you've previously been diagnosed with COVID-19. And the reason is because the COVID vaccine will offer or confer immunity that is longer lasting. So we do recommend that after somebody's had COVID-19 and has recovered from that, that they do get the vaccine. Or COVID infection, if they've had that, then they should get the COVID vaccine after they've recovered.
Okay. There were a few other questions, if either of you would be willing to answer them. And again, how long does it take the vaccine to offer protection?
So based on the clinical trials, they've noted the 95% effectiveness to occur 2 weeks after the second dose of the vaccine. And so it's really important that you make sure you get the 2 doses. One of the trials demonstrated that after 1 dose, it was only 50% effective. And so we'd say two weeks after the second dose. But in general, we don't have long-term data on how this impacts community transmission, so the ability to give COVID, if you're ill with COVID, to other people. And so we still really need to stress that it's important to continue to wear your masks, wash your hands, to keep physical distancing, and having the COVID vaccine is an important addition to your toolkit of ways you can protect yourselves and your families and your community.
Great. And do you know whether there have been any adverse allergic reactions within the city of Alexandria to the vaccine?
You know, I can tell you there have been adverse reactions globally or in the United States. It comes down to a handful per million people. We take that very seriously. We are prepared to respond immediately. We have people wait 15 minutes after the injection, and we're prepared with trained nurses to immediately respond. Our paramedics are immediately available to transport people to the hospital if necessary. So there have been instances of severe allergic reactions. Now, I think there was the question, should I get the vaccine or should I not if I've had a severe reaction before? And the recommendation is if you've had any severe reaction, meaning shortness of breath, wheezing, your throat is closing up after a vaccination, that you not get the vaccine. That's one of the questions. It's one of the screening questions that we actually ask.
Great. And should someone take a COVID test prior to going to get his or her vaccination?
That's not necessary. We do ask people if they have any of the signs or symptoms of COVID-19, if they're ill, not to come to the vaccine site. You know, the way that we're working this is people only come to our vaccine clinics or go to our community partners who are vaccinating only if they have an appointment. But what we're wanting to do is to keep everybody safe. So we're also doing the screening questions about whether or not somebody is ill at the time. So one of the things that is really important is people stay home when ill, and also even when they come into the vaccine clinic, we have them wear masks.
If I may add to that, the reason behind that as well is because when you're actively ill with COVID, your body's fighting the illness at the moment and isn't ready to learn from the vaccine. And so it's really to your benefit as well to wait until you have completed and recovered from an illness from COVID. So that would mean 10 days after you first became symptomatic with COVID or had the diagnosis of COVID, to give your body a chance to really fully learn from the vaccine. And so we still recommend you get the vaccine after you've recovered, but to wait 10 days after your recovery.
And Dr. Luke, if I may build on that, I have heard that it's better to wait maybe 90 days because you've got antibodies in. So it sounds like that's not really the case. That any time after you've recovered, you could get it.
You could get it anytime after you've recovered. What you may have heard about is that you do have some short-term immunity from having had the illness, but we've seen that people have been reinfected after 90 days, up to sometimes 6 months. You can get reinfected with COVID-19, and so it's still beneficial to get the vaccine. It's just not as urgent since you have that short-term immunity, so you could wait 90 days if you'd like to.
Okay, and one more set of questions, and that is if you could briefly let us know about the availability and delivery of the vaccinations within the city of Alexandria.
Sure. You know, initially when we first started vaccinating, which was on Christmas Eve, December 24th, the only eligible people were those that were healthcare providers. So those that worked in nursing homes, doctor's offices, the hospital. And we immediately started vaccinating all those folks and those who are 75 and older. Shortly thereafter, we, along with 10 other health districts in Virginia, moved into what was called Phase 1B. And Phase 1B opened it up to a whole lot more people. Shortly after we moved into 1B, 1B actually was expanded by the governor's office to include a whole lot more people. So right now, it's people age 65 and older, those that are age 16 to 64 with an underlying medical condition, and then frontline essential workers. And the frontline essential workers, Evelyn talked before, it's working class folks, those who are at grocery stores, for instance. But it also includes our first responders, our fire, police, EMS. It includes human service providers. It includes our K-12 teachers and our child care providers. So all of those people are eligible to get the vaccine. However, there's also availability. And there's a whole lot more eligibility, a whole lot more interest than there is availability at this time. It's really important that I emphasize that everybody who wants a vaccine will get it eventually. But right now, at this juncture, and sometime through the second, third week of February, maybe all the way through February, we're being told that in Alexandria, we will be receiving less than 2,000 doses per week. We have pre-registration for people. And in our pre-registration, we have over 20,000 people who have already pre-registered. What we're doing is we're going through the pre-registration list and we're matching it against eligibility. And we're focused on those people right now who are at highest risk of severe disease, those who are over age 75. And we're focused on that group of first responders and our K-12 teachers and our child care providers. We'll keep working through these lists over time so that as we finish with those 75 and older, we'll also work on those 65 and older. And then we'll expand into the other frontline essential workers. So that's been real important to us. It's in alignment with our public health justice principles of really using science, of saving lives, and of really reaching out and empowering people who are most in need.
Great, thank you. And I just want to also note that COVID is not just a health crisis and a health issue, that there are other reasons to be vaccinated that deal with specific human rights issues, economic factors, and of course, social issues as well. On the human rights issues, it's always going to be a question of who gets the vaccine. Is it going to be available to people of privilege first, or will it be equitably distributed based on need, not on income, or other issues we think about? Will it be available in clinics where folks who may go there for their primary care congregate, just so there aren't areas in our communities, particularly our vulnerable communities, that are left out? In terms of economic factors, it goes without saying that there are associated childcare costs that weren't incurred before by people who don't have their kids going to school in person. There are food insecurities that have arisen once folks have lost their jobs and their sources of income. And then, of course, there are basic home schooling costs. You need good internet access, things like that to be able to have your kids stay ahead and not fall behind. And then, of course, we all are aware of the social costs involved with this terrible pandemic. I mean, we can't see loved ones, we can't travel, we can't see family or friends. And there's a mental aspect, mental health aspect dealing with just the isolation, which we've all been confronted with, where prior, we were out seeing people and talking to people, and now we're all cooped up for the better, but nevertheless, we're still isolated. How will the vaccine serve to help solve these problems if either one of the doctors could opine on that?
Sure. We definitely feel everybody's frustration, and we definitely understand the disproportionate impact that this has had on working class, on people of colors, on essential workers, like you've outlined, all those things that you've outlined. One of the things that we focused on as early as February of 2020, almost a year ago, is who is being most impacted in terms of survival. And a big part of our focus has been on the essential workers at long-term care facilities, at our skilled nursing facilities, and our assisted living facilities, as well as our independent living facilities that have low-income seniors living in them, the high rises. So our focus has been on them, and it will continue to be on them until we get all of them and the workers and the residents vaccinated. We're doing really intensive outreach to employers of essential workers, and they're part of the pre-registration that I talked about before in terms of having grocery stores, for instance, lined up and lining up their folks. So that way, when we're getting ready to vaccinate them, we do specific outreach to them so that they can get registered for an appointment for a vaccine. The whole issue about learning and about childcare is a very high focus. That's why that group is group number 3 in 1B. And we've been working on them already, and we'll continue to work through them because we really do want to get our teachers comfortable about the whole issue of COVID-19. We want to get our childcare providers comfortable. And this vaccine will make people feel more comfortable when you look at the effectiveness that it confers.
Great, thank you. Jean, would you like to discuss some Alexandria specific issues?
Absolutely. Because I think we need to continue to focus on the reluctance of individuals to get this, the skepticism. And although you're assuring us that there will be equitable principles that are provided throughout this process, I know there'll be individuals who will wonder, you know, is there someone else who's moving to the head of the line? And there's a tough juxtaposition between wanting to be included, I think, but also maybe not wanting to be first or wanting to be, you know, an experimental group. I've heard some of those sentiments as well, based on history, where there are members of the community who think, well, I might take this, but maybe not, I don't want to be first. And are they imposing on certain communities of color, you know, to be at the head of the line? Can you address some of those questions and issues that may not be justified truly in the medicine, but think of ways that we can reassure individuals?
Sure. You know, the concept of adoption or to reduce one's hesitancy is not uncommon. We always know that there's people that want to adopt something very early on, and then there's others who prefer to wait. And we certainly respect that. We want people to make an informed decision when they're ready. There's the reason that the Centers for Disease Control and Virginia Department of Health and others have made priority groups is to help to maximize the benefit and minimize the harms. And that maximization of the benefits includes reaching out to those frontline essential workers, those who have jobs that they can't telework, those that have jobs who do not have health benefits like sick leave. So when we make that sort of focus, it helps to address that. And I'm not sure if Mr. Harris, Christopher Harris, had a comment or a question.
Yeah, I mean, the question I had was, how is the information being disseminated about the vaccine? Because I've talked to a number of people in the healthcare industry in the city that didn't even know that the option was available. They didn't know until they saw the lines throughout the city and realized they were for the vaccine. So I question how this information is being disseminated and if it's being equitably transferred to everyone, being that everyone doesn't know that the vaccine is available when it is available. And I've had that conversation with numerous people, and I just kind of question, you know, how widespread and how equitable is the information being disseminated.
Thanks for that question. You know, there's no perfect approach to this. It's very complicated. For instance, even in English, because things are changing so fast. One of our emphases at the Alexandria Health Department, and we're part of Virginia Department of Health, is we're really pushing to them that when they release information in English, that they simultaneously, same time, same day, same email, release it in Spanish, Amharic, and Arabic, our major languages here. What we're doing really, that's very important, is we're doing proactive outreach to the businesses of those frontline essential workers. And then the other thing that we're doing, and I'm proud to say, as far as I know, we're far ahead of any other health district in Virginia, is we're doing a lot of outreach to our pharmacies and to our healthcare providers. There's a complicated process that those people, those community providers have to go through in order to be eligible to receive vaccine and to administer it to people. Dr. Luke is spearheading and actually leading those folks through. We have about 8 providers that currently provide the vaccine, and we have 4 or 5 more that are in line to start. So we know that a lot of people really depend on and rely on their doctor, their nurse, their pharmacist, that they're trusted messengers. I should say a preponderance of those providers, all but one, are in zip codes where we have folks that are most vulnerable to the ravages of historic and systemic current racism and bias based on color or ethnicism or on country of origin. So we're working with those providers who are the same as the community.
So just to piggyback on that, what about the individuals, and is namely the Black and brown communities that don't have, that may or may not have a primary care physician, or may not have insurance, or may not have the resources to walk into a doctor's office and say, I want the vaccine? I mean, those are the communities that are most affected because they don't have those resources.
That's exactly right. And you know, what this pandemic has done is it has presented and highlighted and focused the ravages of this long-time systemic racism. It's not just the COVID-19, but it certainly highlights the problems that these communities have been suffering for decades and centuries. What we're doing, again, is we're focusing our messages. We're depending on community leaders. We do a lot of town halls with actually community groups with residents. So we're doing constant outreach and engaging both the trusted messengers, the community leaders, our healthcare providers, and then going directly to the community itself. If you look at the demographic of the workers, the staff at the health department, we definitely reflect our community in terms of languages, in terms of color. So we also have our folks doing that direct outreach as well.
And Dr. Herring, you've touched on the fact that there really are twin pandemics, COVID-19 and racism. And 2020 was a very, very challenging year because of those two forces at work. Chris raises a really important point about getting the information out, because I know I have seen what comes out from the governor and from the state health department, and certainly you and our Alexandria Health Department have put out lots of information in multiple languages. And so, you know, I would hope that healthcare workers and frontline workers now would know that they're eligible, certainly. But I think one of the impediments can be registering in that VAMAS system. I know that's the system that we have to work with. Even some of my staff who are lawyers were asking questions about, well, how do I answer this question? You know, if I may be eligible, but then is there a subset of what if I have an underlying condition, and how much information should I divulge? So there were those practical questions. And, you know, so I'd like for you to address that a little bit, you know, just the reality, the logistics, because what you're saying about the supply is so daunting. If you're getting 2,000 doses a week and there are 20,000 already registered, we can do the math and say that puts us out 2.5 months. You know, when will, and maybe Dr. Luke could answer this, when will the other providers be able to provide the vaccine? And how do we communicate this, that people should get it, but then they can't get it? They either can't sign up or they can't get an appointment and they have to wait.
You know, it's a real conundrum. It's a real challenge for all of us. And Jean, we feel this frustration. We can only provide what we receive. And of course, what we're doing is we're working closely with the city. The city has set up a system called the Joint Information System that is helping the health department to provide information to the community so that that information is quick, readily available, and it's in multiple different formats, if you will. And those formats include our doing town halls, it includes mailers, it includes the website, and we'll continue to provide the information in multiple different ways. You know, we're working with senior centers, for instance, one of the things that we're really worked a lot with, and that is we'll work with senior serving organizations, and actually we set up the appointment for the seniors to get the vaccine appointment. So when we have our list, and the list can be one of two ways, through pre-registration through the internet, but then for those who are not able to access the internet or have challenges, then they can actually call our hotline, and then we register them directly. And when they're next in queue, we call them and we set up an appointment for them through our community providers or through our larger vaccine pods. It's going to be a challenge in coming weeks through February as we have continued increased demand, but a steady low supply of the vaccine. So one of the things that we're messaging is that everybody's going to get a vaccine who wants it. We'll get it to them eventually when we get it available. We'll do that through us. We'll do that through our community providers. And we also know the state and many healthcare systems are setting up very large pods to be able to administer to a lot of people on one day. So in short is we're saying that we are addressing these issues that have been underlying and exposed by COVID-19, and will continue to work. Quite honestly, I think part of the challenge has been that on a federal and state level, public health has undergone budget cuts for 4 decades, nearly yearly for 4 decades. So our public health infrastructure is stretched right now. We are so stretched. It's not to say I'm not coming up with excuses. I'm coming up with explanation that we're very stretched, but we're also very focused, and we're very passionate about accomplishing our mission of reaching those who are most vulnerable.
That passion is evident. I'm just hoping Dr. Luke can talk a little bit about the other providers and when they might be online, and how you work with the Innova system, and whether there's another supply chain for those other providers.
Sure. So we're working to get all of the very eager and interested providers ready to be in the system to receive vaccines, and that itself takes, I'll be honest, it takes several weeks, if not longer. The main reason is because they need to fulfill all CDC requirements for receiving the vaccine, including having their own healthcare record system, the electronic healthcare record system, communicate directly to the CDC's programs and to the state's immunization record programs, so that we know exactly how many vaccines are being administered among those that are being distributed to them. And so that ensures that there's no waste, no vaccines sitting on shelves. And because of the very limited supplies that we have, the ones that have already been set up, you know, they were extremely eager and got everything ready ahead of time. We're only able to distribute just a handful to those providers at this moment. And our hope is that our supplies are going to be expanded in the months coming, and they'd be all ready and lined up to receive the vaccines. But until then, it's going to be difficult to get access within your usual providers. And the health department currently is setting up multiple mass vaccination events a week, so that we can reach those who might not have a usual provider, and we want all the others to be ready when vaccine is available.
And if I could jump in, I'm not sure. I think Evelyn might have a question or a comment.
Yeah, I think I would like to touch a little bit about our concern in the Latinx community, right? We knew it and we saw it when COVID-19 and the testing and how that went in our community. We really have to get that clinic, and the neighborhood clinic was doing a lot of work in the community, and they continue doing the work. So we haven't seen so much about the health department really being up there in our community the way that the neighborhood clinic have done it in the past. So in our community, looking at right now, a lot of the employees a lot of our families work on the construction site. We haven't talked about that, right? We talk about, restaurant workers and, but a lot of the families that get COVID-19, it was because we live in small apartments, and also they were going out to work. And one of the areas that didn't stop, it was the construction workers. So I wondered how that's going to work with them, right? What part on the list are there going to be an opportunity for them to get the vaccine? The other part is really focusing more on the any contractor, whether it is people who do deal with the technology, that they're not no employee, but they're subcontract. And looking also at the ages of 16 and 18, right? That they don't 16 and younger, that they don't qualify for this. How are we going to be looking at them, right? But also how your department is going to be really reaching out to this community, like the Alexandria community, like the Western community, right? That usually they don't have a doctor, so there's no way that they can see a primary doctor. They don't speak English very well. Lack of access to the internet. And this probably are the families who have been getting really sick, because we know that the high numbers in Alexandria at the beginning of the pandemic were really high. So how the health department will manage with this at this moment, looking at the priority, looking at the people who got sick and who should be focusing on it.
Absolutely. Thanks, Evelyn, for those questions. First, and there's a lot, so if I don't cover every point, please ask me again. With regards to the testing, we actually have promoted and we funded, the city and the health department helped to coordinate the testing that Neighborhood Health did. So what you saw from Neighborhood Health was actually because of our partnership with them. And our partnerships are multifaceted with them. So you mentioned something about construction workers and the crowded housing. Again, this points to the ravages that the pandemic is having on people that are disadvantaged already before the virus has impacted our global community. And then it disproportionately impacts the folks that you're representing and that you're talking about. And so we at the health department can only highlight the underlying structural problems and then address the things that we're able to address. One of the things that we're able to address is data. And every month we put out data that reveals exactly what you're talking about how some zip codes are way disproportionately impacted and affected. And so by highlighting that, it actually helps to highlight to our community and much broader that this is disproportionately impacting people. Specifically about construction workers, we have done a number of different things with them. Early on, we worked with our code administration. The code administration is the city department that goes out and checks construction sites to give those folks information about wearing a mask and distancing when possible and where to get tested and treated. In terms of testing and in terms of the vaccine, there are no charges for anybody without insurance, and there's no checking for status. We now have 3 sites that people can go get tested, and this is another thing that the health department did, and the city was a great facilitator of this to get testing sites set up 3 different locations throughout the community such that people can now get tested. I believe it's about 150 hours a week, 7 days a week, one can go get tested. We'll continue to work with our community providers, as I talked about before, Neighborhood Health and others, to get them set up for vaccine administration. The real challenge, and I keep coming back to it at this juncture, at the time of this video, is the severe shortage of the supply. So we cannot provide vaccine that we don't have, but we can share what we have appropriately. And we can also continue to emphasize the message to people about how to stay as safe as possible. Did I cover everything, Evelyn? Or did you have other concerns?
I think I asked a question about the 16 and younger that are not part of this, what is the plan for that, if there is any?
Yeah, thank you. That plan is actually at the federal and the global level. The studies have only been done currently for one vaccine on those 18 and over, that's the Moderna, and then on the Pfizer vaccine on those age 16 and over. I understand that there are studies that are being done on adolescents age 12 and older, but this is the sort of way that pharmaceutical companies and governments actually study. They start with those who are adults, and then they go to younger ages later on in the process. The good news, if you will, is that typically for our younger people, those under the age of 18, that when they get COVID-19, if they get the infection, they don't get it as severely. It's less common that they need a hospital care for that. Of course, the concern still is, as you talked about, they live in crowded housing. So if they catch it, they bring it home to their grandmother or their uncle who might be elderly. So we're concerned about all of them, but at this juncture, there's no vaccine available for anybody younger than 16. I believe that will change in the coming months.
And Dr. Herring, you've talked about following the phases and prioritizing even within those phases and those categories. Someone in the community has asked, and I should mention again that when we issued the press release for this panel discussion as being the first in a series, that we solicited questions from the community, and we received well over 125 questions. And we did, as I mentioned, group them together. But a specific question that was asked is, can you get moved up the line for a vaccination? If someone is actually asserting a real need or an underlying condition and hasn't been able to get an appointment, I mean, how do you address that with a person who is eligible and just feels as if he or she needs to move ahead in the line?
You know, one of the things that actually encourages me and the health department is that there is such interest in the vaccine, because that tells us that people recognize that this is the way out of this issue, that the vaccine will save lives, it will help us to return to normal. And I'm hopeful, actually, we return to better, that we recognize and do things about the underlying structural issues that have caused disproportionate impact, that we see the disproportionate impact by COVID-19. We're not allowing people to cut in line, if you will. We're really focused on those who are age 75 and older. When we finish getting through them, we'll do 65 and older. And then concomitantly, just like it takes two legs to walk on, that's one leg. Concomitantly, we're spending half of our focus on the frontline essential workers, the working class, the people who work in grocery stores, for instance, those who are healthcare providers. We're still focused on them to assure that they are not cut in line in front of them. So does that answer your question, Jean?
Yes, absolutely. And with respect to the supply, because I know that's a big part of the impediment that you have, if someone has received the first dose and is waiting for the second dose, and I know you have a robust communication plan in place to make sure those folks come back, is there a separate supply for that second dose, or how does that factor into your supply issue?
Yes, there is a separate supply. So what happens is the federal government gives it to the states, and then the states give it to the health departments. So let's say we get a shipment of 1,200 Moderna on a given date. We use that 1,200, and then about 3 weeks later, they give us 1,200 more Moderna so that we can go back to the first 1,200 people and vaccinate them with their second dose. And that's important, because as we get people finished with their second dose, that means that we don't have to vaccinate them again, hopefully ever, but we'll know with some time how long the immunity lasts. Things change, of course, all the way through this. If there's one thing we've seen, that things change, but that's why we have our principles that we're following in terms of really following the science and focusing on those who are most at risk for dying and empowering people who are most vulnerable.
Dr. Herring, quick question. Do you, in regard to that, if individuals that get the first dose, if they don't get the second dose, does it render the first one useless? Does it like they never had it?
You know, it doesn't render them useless, and I'll have Dr. Luke jump in a minute, because there's a certain amount of immunity that they get if they just get one dose, but it's not nearly 95%. But even, like, there's going to be new vaccine that's coming out, and we're hearing, and I'm not sure when it's going to happen, it probably won't happen till late February, March, maybe even April, where the effectiveness is 75%. But to put it in context, when we talk about influenza vaccine, it is frequently about 35–40% effective. And even with 35 to 40% effective, we know that it saves lives, it saves tens of thousands of lives, and it prevents hundreds of thousands of hospitalizations with something that's 35–40% effective. Dr. Luke, do you know specifically about the effectiveness if you just get the first dose of Moderna without the second dose?
So I don't know the specific number, but I've heard that Pfizer specifically has had a small study where they had seen a 50% effectiveness after the first dose. We'd still really highly recommend everyone get the second dose because we want to reach that 95% effectiveness. That is a lot, you know, we have more data to support that.
Matt?
Yeah, either of the doctors. I know some states are tracking the demographics of who is getting the vaccination. Virginia, if I understand correctly, does not do that. Is there an ability for Alexandria to do that? Because in states that do track, the numbers are very disproportionate towards the majority getting shots and not members of underrepresented communities.
I know that when you look at the data, and Virginia does provide some data, it's not nearly what they're wanting to be able to provide. The state is disproportionately white, and we're working on that local data. I think this is an example, if you will, of how the chronic underfunding of public health, we're not able to provide the sort of data that we all want, so that we can highlight the issue and then help focus our attention on where we can do better. I do know that we're not waiting to actually see specific data, but we're working on providing that locally.
And another question that has come up is, what should a person do who works in the City of Alexandria but lives somewhere else?
Sure. And I want to get back to the data issue. As soon as we have it, we'll be sharing that. If you live in Alexandria and you're in one of those eligibility groups, then you can pre-register and you'll be on our list. If you work in Alexandria but live elsewhere, you're also eligible if you're eligible to receive the vaccine here in Alexandria if you're on the eligibility list. And that means if you're 1A, that would be a healthcare worker or human services provider, or if you're 1B, 1, 2, or 3. And that means fire, police, EMS, sheriff. It means those who are K-12 teachers and childcare providers, they could live somewhere else, work here, and they're eligible. And that will be the case as we work through all the different priority groups, whether it is grocery workers, transportation workers, construction workers, that if you work in the City of Alexandria, you'll be eligible when the vaccine is available.
Dr. Herring, what kind of information is gathered to get on the list? You know, when they sign up for the list, what kind of information is gathered? Is it demographic information? Is it what kind of information is gathered?
You know, there's different gatherings of data at different steps. I know that when we're pre-registering, what we're doing is we're getting name and first name, last name, and then contact information, whether that's an email address or whether it's a phone number. the data later when you're actually scheduling an appointment and registering through the vaccine management system, that gets a lot more detailed about and actually I should tell you, even when you're pre-registering, we're gathering the data in terms of age, underlying condition, and where you work, so that way we know where to put you in the queue. So does that help? And then later, there's different data systems, if you will, that will provide us the information. Dr. Luke, I'm not sure if you know if this, and again, that's another system, does that provide the demographic data by age and race and ethnicity?
I've been able to ask, and it takes a lot of coordination to get this information because the central office in Virginia is very tightly staffed. And so when I did ask about, how many did this provider vaccinate that was over age 75, they were able to get me that data, but it's, somebody looking actively and getting that. I haven't gotten information about race and ethnicity, but I can certainly try to find out.
And I should add that, again, we've had no real good database, and we started with one called VAMS, V-A-M-S, that's an acronym, and we're in the process of transitioning to what's called PrepMod. That one will be implemented sometime first or second week in February. And Jean talked earlier about the complicated mess of navigating all of this. And we're hopeful that this state rolled out system will be able to be simpler. But one of the things that we have an advantage of in Alexandria is the city has been very proactive with us in helping to do workarounds that make pre-registration and registration and scheduling an appointment easier for people.
And will we be able, as a city, to look into that system and to be able to identify disparities and disproportionalities going forwards and make some corrections somehow this spring?
Sure, that is absolutely our hope. Is that when we say we follow the science is about data. A lot of times people talk about being a data-driven organization. Well, public health is rooted in data. That's what we do. That's what our epidemiologists do. So when we see that there are issues, and if we have it by zip code, by geography, we'll address it that way. If we have it by age, or if we have it by race or ethnicity, then we'll address it that way, again, with our community leaders, for instance, those who are part of this panel.
And so we're in phase 1B right now in the Commonwealth of Virginia, but we still have not vaccinated everyone in 1A, correct?
There's it's hard to say exactly because one doesn't have a list of the close to 10,000 1A who either live or work in Alexandria. So we find out, and we don't have a list of the names of those 8,200 people who are over the age of 75. So what we're doing, whether it's 1A or whether it's 1B1, 1B2, is we do active outreach before we move to the next priority group. So we've been really doing a whole lot of active outreach. And when we find out that a given group, say the 1A, the healthcare workers and human service providers, we're contacting all of them through their employers. And when they stop responding and we have vaccine appointments available, that's when we move to the next group. What we're really focused on is covering these groups in order, but also moving rapidly to the next group so that we never have a vaccine appointment that was left unfilled, and that we use all the vaccine within a week when we receive it.
And just to add to your points, Dr. Herring, the door doesn't close behind 1A when we've moved to 1B. So, there may be some that either were too busy to go or wanted to think about it a little bit longer. And so if that is the case, they would still register and still be able to get vaccinated.
That's a really good point. And I'm guessing that the Commonwealth will not move to 1C until there is more of a supply. Is that fair to say?
You know, that's my guess, Gene. And again, it's hard to say. Already 1B is half of Virginia. It might be that when they determine that there is greater supply and that vaccine appointments in various places of Virginia are not being filled, that they might just move to all of Virginia. So I think only time will tell about that. What we're focused on now, of course, is getting the vaccine out to people who are interested and at the highest priority groups.
We're going to be running up on our time. We want to conclude this in about an hour. We can go over a little bit. What I'd like is to touch a little bit on registration and make sure that everyone's listening to this will know how to register, especially if the person says, I'm 1B category 2, something like that. So maybe talk about the logistics of registration. But then I'd like to make sure that Evelyn and Chris have had their specific questions answered.
So I can take the question about how to register. There are two methods at this time. And so one would be to go to our website. I might need a little help on the...
I have the website, and
okay,
that's what I was just looking it up to make sure I had the right one. Thanks, Dr. Luke. The website is alexandriava.gov/vaccines. alexandriava.gov/vaccines. And then there's a button that's just right there. It says pre-register for vaccines.
The other, yes, the other is if you need assistance, if you don't have access to the internet or a web browser, that you can call our hotline at 703-746-4988. That's 703-746-4988. And we have people who are ready and willing and happy to assist to set you up with a pre-registration.
Okay, great. And just to share some final thoughts, I'm hoping that Evelyn, perhaps first, can share some final thoughts, and then maybe we can be thinking about how we all can help you in the health department to achieve all of the goals that you have, especially in the areas of equity and fairness. Evelyn?
Thank you for the opportunity. I think we learned a lot through this conversation. I think moving forward, more thinking about the future, right? I really think about the community that I work with, and I really think about the challenges that they have just to have access, right? And I know that we're dealing with two things in here. One is the supply, how much supply we have, right? And the other one is how we educate in the community. We know that a lot of the families don't feel comfortable because, that communication get through different channels and not necessarily is getting probably to the right channel. So, moving forward, I think for me would be more like what else it can be done to really reach out to these families. Because even though we don't have that vaccine for them at this moment, it's coming up. Right? And hopefully it's going to be accessible to everyone. And, and we talk about equity and access, and usually the working class is the community that is behind, way behind. And I know that some of you highlight really, really good the issue that we have been going through for the past 40 years. But I think it's time to change that. And I think when I say it's time to change that, it's also to change the way we practice. Our thoughts is, it's not just about thinking we were behind and we're going to stay behind. It's like how we can make progress, acknowledging that there is an issue and it has been an issue in the past. And communication is a key. Education is a must. So I think moving forward, we definitely have to really focusing on how we're going to be educating these families to ensure that when that vaccine is there, they will be willing to take the vaccine. because that's one of the biggest concerns. I think it's really lack of education in our community at this moment, and we have to work hard on that. Thank you.
Yes. Again, I definitely appreciate being a part of this conversation. We do know that we do have challenges that are ongoing. I think a good start would be acknowledging that the vaccine hesitancy is a legitimate issue, and understanding that it's justified in the thinking in the community based on historical data of everything that's transpired over the years. And once we acknowledge that, I think we can move forward, and maybe we have to go a step further in outreach, to give better information, to make sure that trust is established, make sure that we're going above and beyond to educate these communities and let them know that this is safe, this is beneficial, this is the way to get past this pandemic. And it is a challenge. And I'm sure a lot of communities may or may not want to go the extra mile to do that. But I'm confident that Alexandria is not one of those communities, that we will and can go the extra mile, but we have to do it collectively. And I think initially just the understanding that those things exist, those thoughts, those premises, and the reason for the hesitancy. I think in the midst of not having a vaccine available to everyone, I think a good push would to encourage testing when we have these symptoms, because there's a lot of people walking around here now that don't know they're sick, and they're sick. And encouraging them in the midst of waiting for the vaccine to go get tested, to not ignore some signs. I mean, just for a sake of transparency. And yesterday I was tested positive for COVID. So I've been walking around feeling good. I just happened to get tested because my job required it, and lo and behold, I'm positive. And I would have never known if I didn't go get a test. And I can only imagine the number of people that are walking around now with the same thing. And it's scary because, I don't know who I could have possibly infected. I don't know where I got it from. And it goes to show that you don't have to walk around on your deathbed to be carrying something that could be detrimental to everyone around you. And it gives me a little more, awakening of how serious this is. I mean, I feel fine. I look fine, but apparently I'm not fine. And it's possible that, me being as healthy as I am, I could expose someone that doesn't take it the same way, that could possibly kill them. So in the midst of waiting for this vaccine, I think the push should be to, get tested and take everything seriously. Even if you have to overthink it, even if being extreme with it, just make sure that you're taking all precautions and make sure that, you're covering all boundaries. And that's my thought.
Evelyn, Gene, if I can just say
yes,
a couple of things real quick. Evelyn and Chris, thank you very much for those comments. That I and the health department absolutely agree. There's always more that needs to be done, that can be done, and we're dependent on our partnerships with your all's organizations to help us help the communities through this. We don't get everything right the first time, but two of our values at the health department is working together and improving continuously. So when we consider those values, not just internally, but externally as well, we are dependent on the feedback about how we can do better, how we can be more efficient and really more effective in our communications and in getting people the information that they need to actually make informed decisions that will help to protect them and help to protect their families and help to get us back to better. So I appreciate your all's input and look forward to continued collaborations as we move forward.
Thank you,
Gene,
Dr. Herring and Dr. Luke. And I want to close out with Matt Harris, actually. this has been a wonderful experience. I've learned a lot. I thought I already knew a lot from participating on committees with the city, but I've learned a great deal today. I appreciate your candor, Chris. And vaccines save lives, and as you all have touched on, they give us really the power to end this pandemic. I'd like to certainly thank Dr. Luke, Dr. Herring. I'd like to thank Evelyn and Chris for giving us this community perspective. And I'd like to give Matt Harris the final word. He has been very articulate in writing letters to the editor and in communicating with advocacy groups. So Matt, I will let you close this out for us.
Yeah, thank you, Jean, and thanks for all you do for the city, as well as the doctors and Evelyn and Chris and the rest of the group who put us all together on this important Zoom meeting today. And I'll be quick. I just think we all need to be ambassadors in our own little circles that we routinely go upon day to day. If you tell 5 people and they tell 5 people, before you know it, we've got this under control. And I think generally word of mouth is really the best way to get your friends and neighbors comfortable with getting the vaccine when their time comes. It's important to realize, none of us live on an island. If there's a community that is not vaccinated, I'm still coming in contact with them, and no one is immune to this. That is one of the, if there's a good thing about this pandemic, it's that we all now understand the need for universal health. If not care, then realization that we're only really as healthy as the weakest among us. So with that, again, I want to thank you all for your time, and I'll hand it back over to you, Jean.
All right, thank you, Matt. And I'm just remembering something that you said yesterday, Matt, that it's not often that someone who's not in the medical profession can save a life. And so I think that we all can share in the possibility that we're going to try to help save lives by communicating together and joining together. Thank you to everyone, and definitely thank you to our interpreters and our technical staff who've done a great job helping us record this experimental first in a series of panel presentations on COVID-19 vaccines. Thank you all.